Hello everyone, welcome back to our channel. So from today we will see the general anatomy classes. First we will see the introduction to anatomy. Those who have not subscribed to the channel, do subscribe now. Keep watching the videos and also you will receive the notifications. In this video, we will see the history of anatomy and also the anatomical terms and planes. Do you know the father of modern anatomy? Andreas Vesalius, who is an Italian. Rightly quoted in his De Humane Corporis Fabrica, anatomy should rightly be regarded as the firm foundation of the whole art of medicine. Students in medicine first realize the importance of anatomy when he is brought to the operating table of the patient. So he is the Andreas Vesalius. Do you know the history of anatomy? GALEN wrote on the subject of anatomy. You see, it is in 200 AD. His textbook on anatomy described human anatomy principally from dissections of animals such as pig or monkey. So, it must be obvious there are substantial differences between the anatomical structure of the pig or monkey and that of the human being. Galen and others were not encouraged to dissect the human body as it was considered as a crime under the Egyptian law. You won't believe Galen's writings on human anatomy were the unchallengeable authority for the next 1000 to 1200 years, even though it was written on the anatomical structure of the animals. Medical schools lacked the authority to acquire dead human bodies for dissection until the 13th and the early 14th centuries. Such authority was granted in 1242 by Frederick II, the king of the two Sicilies, and again 1302 for the delivery of two executed criminals to the medical school at Italy each year for dissection. How the dissection procedure at that time was. Such dissections were public affairs conducted in open areas during the cold months of the year, as they didn't know to preserve the bodies. Dissection itself was rapidly done, frequently confined up to 4-day period. The actual procedure, the anatomy professor read Galen's books on anatomy and the barber did the actual dissections. Students were not satisfied as there were frequent contradictions between Galen's description of a body part and its actual appearance as disclosed by the dissection. So, this discrepancies encourage the more intelligent students to steal bodies from cemeteries and gallows for personal study and research. So, that much they are encouraging to steal the bodies from cemeteries and gallows. Every part of such a purloined cadaver was probed speedily for knowledge of its structure until it became too loathsome to conceal and had to be disposed of. So that was the interest of the students on human anatomy. Now we will see the human anatomy divisions. The man is known as Homo sapiens under the class Mammalia. The anatomy, the term was derived from anaplastome, meaning cutting up. It's a science which deals with the study of form and structure of any animal. When this study relates to human body, it is called human anatomy. So divisions of human anatomy, macroscopic and microscopic anatomy. Macroscopic or gross anatomy may be studied under living anatomy. That is the living anatomy is the so that we will learn in the living individuals cadaveric anatomy, embryology or developmental anatomy, comparative anatomy, experimental anatomy, topographical or surface anatomy, applied or surgical and clinical anatomy. Microscopic anatomy will deal with cytology, histology, and organology. Mainly, we are teaching histology for first MBBS students, but the future will be the cytology. The living anatomy, studies in living anatomy are incomplete without the knowledge of cadaveric anatomy. So, if you want to see the patients in the second phase of MBBS, you should know the cadaveric anatomy in the first phase completely. Cadaveric anatomy is mainly based on studies on the cadaver or the dead body. In the cadaveric anatomy, study of structures may be taken up in two ways systematically and regionally. Systemic anatomy, so that studying in the systems, locomotor systems, we will study skeletal system or osteology, muscular system or myology, articular system or arthrology, visceral system or splanchnology. In the visceral system, we will see alimentary system, respiratory system, endocrine system, urogenital system, then the cardiovascular system or angiology, nervous system or neurology, special senses. So, this is the visceral system or splanchnology in the abdomen. The other way of studying the cadaveric anatomy is the regional anatomy. We will divide the cadaver into regions: upper limb, lower limb, thorax, abdomen, head and neck, brain, and spinal cord. Usually, for medical students, we follow the regional anatomy, and for the paramedical students, the systemic anatomy is followed. Embryology is a branch of science dealing with the development of the individual from conception to term baby. Comparative anatomy, comparing human anatomy with the anatomy of the lower animals, mainly for the postgraduates in anatomy, this comparative anatomy is important. Radiographic anatomy, interpreting the anatomic knowledge for the study of radiology. So, if you know the anatomy better, the radiology part will be easier. Experimental anatomy, in order to study the functions, growth, and behavior of a particular tissue in normal and abnormal conditions, experiments are done on various ways. It will be called as experimental anatomy. Topographical or surface anatomy is very much important if you have to know the living anatomy. So, recognition and palpation of anatomical landmark searches, bony prominences, muscular elevation, outline of the viscera, so that if you know, it will be easy for you to examine the patients or to do surgeries in the patients. So, this is the way surface anatomy will help you to identify the structures. So, this surface anatomy demonstrates the lacrimal system or lacrimal apparatus. Applied anatomy, while doing surgery or practicing medicine, anatomical facts are correlated for the sake of successful operations or treatments. So, applied anatomy is essential for better understanding of pathological condition and also helpful in diagnosis and treatment. So, the same we call it here clinical anatomy also. Histological anatomy, tissues after necessary preparations are examined under a microscope and details of the cells and intercellular structures are noted. Other methods of studying gross anatomy, apart from doing dissection in the cadavers, we can study with the use of plastinated specimens. Plastination is a dry method of preserving the tissues. in which formalin is not used, easy to handle, widely practiced in the foreign countries. So these are the examples of the plastinated specimens. They will be like dry models. You can hold it in your hands and study, in which formalin exposure will be minimal for the students and for the staff. So still we have covered the history of anatomy and the divisions of anatomy. Now we will see the anatomical positions, planes and relative terms. So, anatomical position is very much important if you want to read the anatomical textbooks, because in each textbook the description is given as if the parts you are seeing only in one position, anatomical position. So, the cadaver may be lying down, or maybe it may be in the standing position. The patient may be lying down or in the standing. So, but you have to understand the parts with one position, that is the anatomical position. So, this is the position of the body chosen by the anatomist for descriptive purpose. For this, human body is recognized as standing erect with the eyes looking forward, arms by the side of the body with the palm of the hand directed forward. So, this is the anatomical position, also the anatomical position of the skeleton. So, you should understand this anatomical position clearly before you start the dissection, so that you will understand how to visualize the structures. Anatomical planes. In order to study the relations of the deeper structures of a particular part, section is made through the part, and the line of section is known as the plane of section. So, what are the different planes for anatomical studies? Sagittal plane, that is the vertical plane, or anteroposterior plane that runs parallel to the sagittal suture of the skull, will be called as sagittal plane. So, this is the center suture is called sagittal suture. So, if the body is cut through this suture, that is anteroposterior plane, that will be sagittal plane. So, these are the various sagittal planes. Coronal or frontal plane, any vertical side to side plane that cuts the sagittal plane at right angle is known as the coronal or frontal plane. It runs almost parallel to the coronal suture of the skull. So, cutting the body cadaver side to side, that is called coronal plane. This is the transverse plane, dividing that part body into upper and lower part. So the any plane that cuts the long axis of the body or part of the body at right angle is known as the transverse plane. Oblique plane is any plane of section that cuts the sagittal plane at an angle is called an oblique plane. So these are the various planes: sagittal, coronal, transverse. In one model it is given. We will come to the anatomical terms. Anterior, looking forwards or towards the front. Posterior, looking backwards or towards the back. Superior is looking upwards or above or higher or more cephalic. Inferior, it is looking downwards or below. So in this you can understand what are the terms used. In, for example, you take the upper limb, it is given medial border, lateral border. And then if you see the front part, that is called the, if you see same upper limb, so that is front is anterior part of the anterior compartment of arm or forearm. If you see in the other upper limb, it is given posterior surface of forearm. So that is how you have to understand the anatomical terms. So this is the superior and inferior, you should understand with this table. Medial is nearer the median plane or nearer the middle line of the body. So if you take any structure, two structures which is near to the median midline will be called medial. The structure which is away from the midline will be called lateral. In these two structures, one is medial and other is lateral, like that. Ipsilateral or homolateral refers to the same side of the body. Contralateral refers to the opposite side of the body, such as right arm is contralateral to the left leg. So, this is medial surface and lateral surface, you should understand. Again, some terms are both used in man and animal. Ventral, that is the towards the belly in animals, that is looking forward, downwards. Dorsal reverse to that of the ventral. Cranial close to the head or headwards. Rostral such as crane, same as cranial. Caudal away from the head or tailwards. So in this ventral, dorsal, cranial, caudal, rostral mainly used in now in the human embryology. So this is the animal ventral surface and dorsal surface. So how to understand the cranial and the caudal. In the limbs, the following terms are used apart from cranial caudal: proximal and distal. Only in the limbs you should use this proximal and distal. Some terms are used only in respect of hand and foot: palmar or plantar. That is mainly in the palm and foot we will be using for anterior part of the hand and anterior part of the foot. Plantar is referring to the sole of the foot, inferior part of the foot. So like this, we have learnt the anatomical planes and terms. Other terms: superficial, nearer to the skin; deep, further from the skin; interior and exterior. So that is the interior and exterior. Anatomical terms are mainly Greek and Latin, even though truly they are Greek and Latin for the first phase students. It is used internationally. Anatomical nomenclature was introduced and followed. Learn anatomy thoroughly to be better clinicians. Thank you. I hope you should have understood in detail the history of anatomy, anatomical planes, terms, and also positions. Those who have not subscribed to the channel, do subscribe now so that you will receive the notifications. And with the other topic in the general anatomy, we will see in the next video.